All right, good morning. This is Jerome Love, founder and president of the Texas Black Expo. And I'm really excited to be here today as we are going to be presenting another one of our $1,000 COVID-19 pandemic grants to Miss Chelsea. Chelsea, go ahead and introduce yourself and the name of your company.
Yes, my name is Chelsea Ball-Lyles, and I am a pediatric occupational therapist. And the name of my company is Bridging the Gap Pediatric Occupational Therapy Services.
Okay, so go ahead and tell us occupational therapy. When I hear pediatric, I hear pediatrician, I just think regular doctor. Sounds like you guys specialize in some type of occupation, or just explain exactly what you guys.
Right. So I'm actually not a medical doctor.
Okay.
I can't diagnose any kids, but I am an occupational therapist by profession, and I specialize in pediatrics, which means I only work with children from birth, newborn babies up to the age of 21, and kids that are going to be seen up to 21, or kids with some kind of special need. So my role in their lives, all of the children that I work with specializing in pediatrics have special needs. I'm on that end of the spectrum versus working with kids that have sports injuries or something like that. So the kiddos that I get to treat are going to be diagnosed with pretty much anything you could think of, from kids that are born at 25 weeks, failure to thrive, Down syndrome, kids with autism, cerebral palsy, just pretty much anything. I get to come in and be a part of their developmental process. My role on the team that they're working with, I'm going to be in partnership often with a doctor, a neurologist, or a pediatrician. They're going to refer the child to me. And then I come in and work on their developmental milestones. And at whatever level they're at, I do an assessment, and then we come up with a treatment plan that's going to best suit that child to help them with development. My goal is to basically, as my company name, is to bridge the gap between where they have dysfunction or where something hasn't been established, and get them to be in a place of increasing their functional abilities. And for children, that's important. The difference with pediatrics versus adults, and my role is an adult, I would be working on rehabbing something that they once had and lost. Kids, you're working on development. It's something they've never had.
Wow.
Yeah, so that's the difference.
That's I guess I never really thought about, children who were born and had to learn things that other children never had to really, quote unquote, learn. Everybody learns how to walk and use their limbs.
Right.
I never thought of it that way, but man, my hat's off to you. Now, I think you would still be classified as healthcare,
I'm healthcare, yes.
which I would assume is essential. So
Yes.
how has the COVID pandemic affected your business?
Yeah, so we are essential. So that, like, we're on the list of essential because of the population of clientele, if you will, that I work with. And then it'll be more specific to the clinic that I have. I have an outpatient clinic. So, and we basically, it's a fee for service. What we provide, kids and families bring their children to us. We provide the service. In the midst of COVID-19, when they started heavily discussing social distancing, then because of the population we work with, we basically tweaked it up. I have a family friend who works at the CDC, so I actually called them directly and said, hey, like, how can we do this safely? And they gave helped me with some guidelines on things to do, down to like curbside, let the kids' parents not come in, you need a safe zone, all of these things. And then as things got a little bit more intense with community spread and not knowing if somebody had contracted something or not, just for the safety of the children we serve, the families, and the staff that work alongside of me, we had to make a very hard decision to close our clinic. So the clinic has been closed. The kids I work with, if you can understand, everything goes in their mouth often. Putting a mask on would scare some of them. Yeah. If I tried to approach them with a mask on, it would just be so overwhelming. If you think of a child diagnosed with autism, it's like you're like a monster coming at them with gloves and masks on. So some of those things that needed to be done would then not be beneficial for the children that we need to work with. So again, the decision was made that the clinic had to close, and we're in Fort Bend County, and where the first diagnosis happened. And a huge population of the children that I get to serve are international, if you will. Their families travel, internationally often. So just all of those pieces of things as we were listening and following guidelines with the CDC and our local community leaders. So
Wow.
it went from bustling, weekly visits of, of 70 to 80 kids coming through to for 3 weeks of
Yeah,
nothing.
virtually nothing. I
Yeah.
totally understand that. It's very interesting interviewing a lot of these businesses. Is so many impacts that you don't even think about that people are experiencing. So, what will you do with the $1,000 grant?
Yeah, so with the $1,000 grant, one of the things that we have just worked on shifting to actually last week, because with everything being fluid and changing, initially my service on telehealth wasn't allowed in a lot of insurance plans. So with everything happening like it is, and social distancing being a big deal to help stop the spread, they've allowed a grace period for services that they wouldn't pay for. And it's a little bit more tricky in detail. So at any rate, I've gotten to see, like last week, I got to see, say, 8 families of, 10, yeah, which is everything's a blessing. And then even for those families where it helps them some kind of normalcy to help, like, what do we, everybody's world's different right now. So with the grant, that'll allow me to help, the therapist that works alongside of me, help to support them, any additional training we need, and some of the platforms for the telehealth service to make sure we're going with that. Anything to help support that, really to help kind of transition us during this period we're in. We're hopeful that, everybody's going to do what they need to do and stop the spread. And once things kind of settle or safer, because we are essential, then I can open back up probably sooner than some other people, but things have to be safe. And even with that, then having orders in, because we'll still have to come in with, like, at least having gloves, more sanitizer available, just things available, because I believe when we do reopen, things are still going to look different initially. So just being able to take care of some of those supply needs that'll be needed, extra deep cleaning at the clinic, just some things.
So one last question for
Yes.
you, and we got a couple minutes left. HEB, Enterprise, and Chevron, UPS, and Shell are responsible for this grant fund. They donated funds, and without them, we wouldn't be here today able to provide you these grants. What, if anything, would you like to share with those partners who are responsible for this grant?
I would like to say thank you, thank you, thank you. Every dollar helps, and for me and my the clinic that I have and the families that I get to serve, it is immeasurable. Like, there's just getting an email saying that I was a grant recipient, just blessed me to the point of, like, tears, because in the midst of this is like not having help coming from anywhere. This is the first, I guess, gifting that I've been able to receive in the midst of this. So it is a huge blessing, and will allow me, the payroll is coming up on the 18th. So to be able to still help with the staff who's not seeing anybody, just to even share portions of it with that. And so I just want to say a heartfelt thank you, and just know that you've made a difference in my life and the clinic life, and it goes beyond me, because there's many families that are served through coming through the clinic, and then my clinic team as well, my clinic family, as we call each other. So on behalf of all of us, just sincere gratitude and thanks, and keep it going. And my desire, and actually a prayer I prayed this morning, because I pray, is that I want to be able to give this back,
Yeah.
the way it was given to me.
Well, thank you so much. Our prayers are with you as well. We wish you the best of luck. And to anyone out there listening, if you're in a position, if you can help us, our goal is to help 100 businesses. Very simple. Go to our website, click on the banner, make a donation. You can also go to GoFundMe. You can look us up there. But we are in need of your support. Our goal is to help 100 businesses. Right now, we're at roughly about 2025. But we really want to hit that 100 mark, and we can make it happen with all of your support. So thank you so much, Chelsea. We
Thank
wish you
you.
the best of luck, and God bless you.
God bless you too. Thank you.